Infantry Division Big Red 1. He used the post 9/11 GI Bill to attend college and graduated from Mount San Jacinto College with 2 associate's degrees and just graduated from Azusa Pacific University with a Bachelor's of Arts in History. He currently serves as an intern pastor at Rockridge Church and hopes to begin graduate school this fall. It is my honor to present to you Charles Wolfe.
Thank you, Tammy, very much. Before we begin, I need to first thank the wonderful staff and the administration here at Mount San Jacinto College, particularly Tammy, for organizing Talon Talks and inviting me to be here with you all today. I would also like to recognize a representative from State Assembly Member Melissa Melendez's office from the 67th Assembly District. Thank you so much for coming today. And of course, I need to thank my lovely and beautiful wife for taking the time out of her schedule to support me today, because none of this is possible without her. Also, I think I might have had you for physical anthropology. So just a brief outline of what we'll be discussing today. This is about a new way forward for the Veterans Health Administration. But first we'll need to illustrate the need for a new way forward, so we will identify 6 major shortcomings currently faced by the Veterans Health Administration. Then we will go through in detail the proposal for the new way forward, a plan for continuing advocacy of that proposal, and then finally we will close. As I mentioned, there are 6 major, easy to identify shortcomings facing the Veterans Health Administration today. The most primary and most obvious of those is the excessive wait times faced by veterans at VHA facilities. Any veterans in the audience today can certainly relate to that issue. Wait times endured by veterans at VHA facilities have become a political talking point. As we enter into another election season, veterans issues will undoubtedly come up more and more, but they've already been mentioned at length, even though we're just coming out of the primary times. Following a damning expose in a series of news stories beginning with the Washington Post and then in broadcast news back in 2007, the VA has attempted to shorten its wait times, but despite their efforts, most data seems to indicate that the administration has made very little effectual change as long wait times persist and some veterans experience stagnant responses to their applications for health care from the VHA. According to a 2014 USA Today article, over 600,000 veterans wait over 30 days for an appointment at a VHA hospital or clinic. That newspaper report revealed these findings again in 2014, 7 years after VHA waiting periods first became a public matter. The problem is so bad that this long list of waiting veterans has earned its own nickname. We call it the backlog. This is shorthand for simply the long list of veterans waiting to experience their first contact with a VHA provider. In their attempts to address the backlog, VA healthcare has, some might say rightfully so, given priority to those veterans who have been waiting the longest. Going back again to that USA Today article, the VA claims to have reduced the number of veterans waiting over 4 months for their initial appointment from 120,000, already an unforgivable number in May 2014, to just 23,000 by October of that same year. However, further investigation showed that much of this was not due to the VA's efforts, but was in fact because of veterans simply giving up on receiving VA health care and turning to the private market. In 2014, 64 VHA healthcare facilities had average wait times of 60 days or more for new patients. Note that this was the average and not the outlier. If this is the mean amount of time, 60 days, that must mean there were veterans, probably a number of them, waiting even longer for their initial appointment. These wait times are not just numbers. These are people's lives. That becomes even more evident when we consider the presence of mental health care in VHA facilities. Wait times for mental health care are often even worse than wait times for physical health care. A separate USA Today article surveyed 33 Veterans Health Administration facilities and found that they had waiting times of over 2 months for veterans seeking attention from a mental health professional. The Journal of Military Medicine shows that suicides among veterans have increased every single year for the past decade. Veterans without a diagnosed mental disorder face a suicide risk that is 33% higher than their civilian counterparts. Veterans with a diagnosed mental disorder face a suicide risk that is 77% higher than their civilian counterparts. So when we look at these extensive wait times, again, 60 days or more was simply the average. And that's not just for physical ailments, that's for mental as well. And then we consider the extreme suicide risk faced by our nation's veterans. We can see that the overlap will yield terrifying results. Veteran suicides have become such an issue that they too have earned a nickname, the 22. It's become a marketing term for a lot of veteran clothing agencies and advocacy groups. The 22 is a direct reference to the 22 veterans who commit suicide every single day of the year. So when we consider the high prevalence of suicide in the veteran community, these wait figures, just for the first appointment with a mental health professional, become almost criminal. Which brings us to the next problem facing the VA, so we're on to number 2, that rising costs of running the VHA will not justify its projected smaller client base in the future. According to an MD and MBA holding doctor, William Weeks, who wrote in the New England Journal of Medicine, the veteran population is currently in rapid decline and is expected to drop as much as 33% over the next 25 years. There are currently approximately 23 million veterans in the United States. This means, ceteris paribus, which is a term I learned in an economics class here, that means all things being equal, the VA could see a reduction in its client base of roughly 7.6 million customers. You might be asking yourself why. You have to remember that we've now gone 2 generations with an all-volunteer force. Remember that the last draft was during the Vietnam era. So, the VA's shrinking customer pool is not just an estimation, it's not just a maybe, it stands as a matter of brute fact. Again, all things being equal. No business, knowing this far in advance that its customer pool will shrink by such a dramatic figure, would commit to carrying on the same business model into the future. That is a recipe for failure. So what is that business model? For the VA, it means providing a majority of its health services by commissioning its own hospitals and hiring its own physicians, nurses, healthcare specialists, and administrative professionals, all at a considerable cost. We have to consider not just their salaries, but the unfunded liabilities that come with them, such as their 401k retirement plans, and in some cases even tuition benefits and student loan repayments. Dr. Weeks, we turn to again, he says, quote, "The VHA finds itself in an unenviable position. It incurs the high fixed costs of a brick-and-mortar healthcare system, the largest salaried workforce in the federal government, and a large administration," unquote. The VA has grown at an even greater pace in the 2010s than we have seen in generations previous, because the VA's primary response to cutting down on veteran wait times has been to simply hire more physicians. Growing the VA's infrastructure while its client base shrinks creates, again another term I learned in an economics class here, a diseconomy of scale for the VA. As we continue to grow the business and the customer base shrinks, you end up with a differential between supply and demand that in the future will be unjustifiable. As the VA grows, it will serve an increasingly small portion of the public. And if things continue as they are, they won't even serve them effectively. Part of that problem is simply a lack of education regarding VA benefits, which brings us to our third major issue facing today's Veterans Health Administration. According to the Journal of Rural Health, of the nation's estimated 23 million veterans, only about half of them, about 11.5 million, are eligible for Veterans Health Administration care. Of those, only 8 million are actually using their benefits. If there are any math majors here today, they can tell you the difference equates to about 3.5 million veterans who are eligible, but for one reason or another, do not exercise their earned healthcare benefits. In a mixed method survey, the Journal of Rural Health found that 1/3 of veterans not using their VA benefits simply did not believe that they were eligible for any kind of healthcare assistance. This was the most popular response to that study. The Psychiatric Quarterly ran a similar survey and came up with the same result, that veterans are mostly unaware of the VA benefits available to them, or their eligibility status. For one reason or another, this was particularly frequent among the African American veteran community. Sadly, the leading reason that veterans seem so confused about their benefits is a long string of misinformation. Mixed stories, rumors, and varied explanations come from fellow veterans, friends, families, and perhaps most damningly, even supposed experts from veteran interest groups. Not just small regional ones, but even the large national ones like the Veterans of Foreign Wars, Student Veterans Associations, and the American Legion. These veteran service organizations, or VSOs, should be our most trusted source for accurate, reliable information about veterans' benefits, and yet in several cases the exact opposite seems to be true. I'll display in a little while how this again falls on the shoulders of the Veterans Health Administration. The Journal of Rural Health concluded that veterans reported information came by word of mouth from their veteran friends and relatives or veteran service organizations, such as Disabled American Veterans, the American Legion, or the Veterans of Foreign Wars. Journal studies concluded that misleading or conflicting information was the primary challenge to enrolling in VHA healthcare. If we can't even distribute the right information, how can we ever expect to bring our veterans in to receive the care that they so desperately need? I mention these veteran service organizations not in a way that I hope raises ire against them, because I don't get the feeling that they're spreading false or wrong information maliciously or even for lack of trying. The VFW is not, despite the appearance of some of its housing, a ragtag band of lazy individuals. It is a nationwide, connected, funded organization of veterans working towards a common goal of a better life for all of us. If there is a way to attain the most accurate, up-to-the-minute information, I think we can safely expect organizations like the VFW or even the American Legion to have it. There must then be some difficulty in how to access the proper information. The next big problem facing VHA is simply restrictions on who gets to use VHA benefits. There are some stringent restrictions on which veterans can receive VHA benefits and which ones cannot. For some, this means VHA healthcare is not a viable option. The VA's current triage system organizes eligible veterans based on the severity of their disability and their economic capabilities. While this sounds somewhat sensible, it does leave many veterans unable to access VHA care. According to the Journal of Law, Medicine, and Ethics, veterans typically come from working families, and their household incomes are too high to garner attention from the VA, but too low to afford health care coverage on the private market. This, even in the age of the Affordable Health Care Act. When the Veterans Affairs Office of the Inspector General, or the OIG, investigated possible mismanagement at the VA Health Eligibility Center, or HEC, it discovered a majority of applications for VHA healthcare stalled when the VHA asked for financial information. In virtually every case, the applicant simply and abruptly ceased correspondence. Healthcare policy fails those that it cannot or chooses not to provide healthcare to. This rings especially true for our nation's veterans who have earned their benefits through dedicated service. If triaging care based on financial need distances even a handful of veterans from getting the care that they need and have already earned, which should be a point of emphasis here, it should be reconsidered, if not outright eliminated. Which brings us to some other barriers to VHA healthcare access. We'll discuss not only the complex application process, but also the threat posed to veterans living in rural areas. The VA application process, again as revealed by the OIG's investigation into potential mismanagement, which was published in 2015, revealed to us, if nothing else, a convoluted, complex network of bureaucrats unable to handle the workload put upon the VHA. In their report, the OIG concluded that the VA did not properly prepare to address the huge workload of applications for VHA healthcare. HEC leadership did a poor job of delegating and distributing the workload to its staff, which added to the HEC's inefficiency and forced veterans to wait even longer for a response to their VHA applications. Just the complexity of the application process locks out several veterans from getting the health care that they've already earned. This is, of course, to say nothing of the other half of the OIG's report, condemning the poor preparation at the Health Eligibility Center run and controlled and managed by the VHA. I mentioned geographic limitations. I know this might not mean much to us in the Inland Empire stuck between the Los Angeles and San Diego metro areas, but much of this country is unurbanized. It's remarkable how much of the physical territory we possess that remains unsettled. Veterans live in many of those areas. Out of the 40-mile radius that is the standard for VHA hospital care. We turn again to Dr. Weeks, who noted that many veterans live outside of that mentioned 40-mile range from their nearest VHA facility, and even that the nearest facility may not provide the level or speciality of care the veteran needs. One thing we haven't covered yet is the way the VHA distributes its healthcare specialists. When we think of a hospital, it's easy to think that it's a one-stop shop for all of our healthcare needs, but this is not true. We have pediatric hospitals. We have cardiac hospitals. Hospitals come with their own specializations like most other businesses, and the VHA is no exception. So with a sparse distribution of VHA healthcare centers in rural areas and a centralization of specialty care and availability of other programs, we see a dramatic reduction in each VHA's customer base to being a very small, geographically convenient community. We have two major veteran hospitals in the area, I think, one in San Diego and one in Los Angeles. So here we're very blessed. But in certain rural areas, like New Hampshire, they don't have a single VHA healthcare center anywhere statewide. In response to this, the VA initiated a pilot program called the Veterans Choice or Choice Card Program, which stands today unfunded and unused. Given its accelerated rollout and stringent requirements for eligibility, the program at best only offered us a brief view to a more effective, efficient vehicle to deliver health care to veterans in rural settings. And finally, the sixth major problem facing today's VHA is simply the negative public perception of the Veterans Administration. I mentioned at the beginning of this talk the long stream of well-broadcasted condemning reports about VA leadership and the lack of care it's providing to veterans. As you can imagine, this has not had a positive effect on how the public views the VA, especially how the fallout from that series of reports was handled. Raise your hand if you are a veteran in this audience. So we have a couple. Raise your hand if you have a positive outlook on how the VHA delivers health care to its members. 0 for 2. So in our small sample size, 0%. Unfortunately for the VA, most of their mistakes and shortcomings have been well publicized, especially in the past few years. This has done possibly irreparable damage to the faith and trust that the public and the VA's own customers have in the administration. And that's not just me blowing smoke, there is evidence. The USA Today reported in 2014 that just 1 in 5 rate the job that the government does in providing veterans with medical care as excellent or good. About half the percentage who gave that same answer in a Pew Research Center survey just 3 years earlier in 2011. The newspaper reported that a downward trend in those who believe the VA is doing an excellent or good job has existed since 2007 and hit its lowest point in 2011. We turn again to the USA Today, which quotes 67% of Americans polled said they see problems with the VA as widespread and not simply isolated incidents. Only 12% are very confident the agency can make significant changes needed in the way that the system operates. In any other setting, I think we would call this a vote of no confidence. The VA needs to take every appropriate action to rehabilitate its image and win back the trust of the nation's public. The only way to do this may be by accepting a completely different model to deliver health care, one that is more efficient and effective, which we will now discuss. I have brought forward today a proposal of a cost analysis followed by private health insurance subsidization for our nation's veterans. At a Voters First forum in New Hampshire, a state that again has no permanent VHA facility anywhere statewide, in August 2015, Republican and then presidential candidate Chris Christie declared that, quote, every veteran should be kept the promise that was given to them, which is they should be able to take their veterans card and go to any healthcare provider or any hospital in America and get treatment when they ask for it. I was privileged enough to watch this Voters First forum on C-SPAN, which if you are not watching, you really should start. Governor Christie does not lay out the fullness of this proposal nor its solution, but he is at least tracking in the right direction. We should consider today in the same spirit that lived in the governor's claim. For each eligible veteran to receive a subsidized private PPO health insurance plan of the veteran's choosing. Ideally, this will allow veterans to choose their own healthcare network according to their own known needs, along with their own doctor. This proposal has a lot of moving parts to examine, so we'll dive right into it. We would begin first with a cost analysis of expanding the VHA versus subsidizing these private PPO plans. I consider myself a historian, and that means I love research. The first step to implementing this radical new direction for the VHA is to justify it through an independent cost-benefit analysis that projects the cost of continuing to expand the current VHA brick-and-mortar model and weighs it against subsidizing healthcare under a new proposal. Congress should provide authorization for this study, but allow a completely independent organization to perform it, to eliminate any possible infection of the results or even accusations of political bias. The supposedly bipartisan organization, like the Congressional Budget Office, does not seem immune to accusations of bias, and therefore, we have a necessity to go outside government to perform this study. Dr. Weeks seems to already anticipate the conclusion. Quote, the VHA could support utilization of private sector healthcare by subsidizing premiums, deductibles, and co-payments for enrolled veterans. Such a move would, and this is the important part, reduce costs to taxpayers, reduce veterans' out-of-pocket costs, and massively expand access to care for veterans without concurrently increasing fixed cost obligations. If this is indeed the result of the aforementioned cost-benefit analysis, a congressionally authorized assessment would provide us with that answer. That answer would go on public record for public view. Evidence that this newly proposed model offers a better and more sustainable new way forward for the VHA. Support from veteran service organizations would be essential at this point. Veterans, like those of us in attendance today, operate on a local and statewide level, and therefore would be integral in getting Congress to address the results of this cost-benefit study and push the VHA to action. Drafting and proposal of legislation would have to consider a core number of essentials. The actual legislation outlining the new VHA healthcare structure would have to take careful consideration to revamp several aspects of the current VA application and eligibility process, including, but certainly not limited to, elimination of triage and prioritization of healthcare for veterans, elimination of financial considerations that affect veterans' earned healthcare benefits, simplification of the VHA application process, universal eligibility to receive care and benefits for all United States veterans not given a dishonorable discharge, unprecedented levels of coordination between the VA, VHA, Social Security Administration, and Medicare, Medicaid to prevent wasteful double spending, and acceptance of recommendations made by the VA's Office of the Inspector General during its investigation of the VA's Health Eligibility Center. So how would this new proposal address the problems that we've outlined? It would tackle the excessive wait times by addressing the issue in the same way that the Veteran Choice Program did, by giving veterans the option to seek private care outside of a VHA facility. This would take them out of the queues at VHA centers. So really we're addressing the problem in two ways, primarily by putting veterans under the care of a private health network away from the VHA's control, which would remove veterans from the VHA system and reduce the pool of veterans looking to receive care at VHA facilities. Effectively, we're going to reduce the stress on VHA hospitals by giving veterans the option to seek care elsewhere. It would address the rising costs versus the projected lower client base, probably best of all. Adoption of this plan would include capping the expansion of the VHA network or even instituting a contraction of that network, thereby dramatically reducing the cost to keep it operating. As stated earlier, projections show the customer base shrinking significantly over the next several years, while the current pace of the VHA will keep it expanding, creating a diseconomy of scale. This proposal will give the VA an opportunity to avoid such dangerous and dire straits by reducing the size of the VHA and pushing veterans on the healthcare networks that are not only outside the VHA system, but are more amenable on the granular level and better prepared to accept the unique needs of our nation's veterans. One thing that then presidential candidate Ben Carson said when discussing his healthcare plan, which is totally separate from this one, that I fell in love with was simply that healthcare is best performed on the granular level. That healthcare is not efficient nor effective when performed in a top-down model. Patients best know their own needs and can identify the doctors to best address those needs. That principle rings true in this plan. Again, we're going to have to address the lack of education regarding VHA benefits. Regardless of how the VA chooses to move forward into the future, it must give sincere reconsideration to the way it informs the public about their eligibility for benefits. A public affairs initiative to inform veterans about their new or old benefits is an absolute necessity. Otherwise, the VA will simply continue to suffer from the same pattern of misinformation experienced by veterans today. This will include new efforts to educate and train local veteran service organization chapters like the Student Veteran Association, the VFW, and the American Legion. Pair this with advertising buys in national media outlets, and you have a new, much more effective way of spreading accurate, reliable information. In doing my research for this proposal, I discovered a bill that was introduced to Congress in 2008 called the Veteran Benefits Awareness Act of 2008. It passed the House of Representatives that year, but stalled in the Senate. This led me to believe that the VA was actually barred somehow from purchasing national media time and space to spread information. That perhaps it would fall under some quirky propaganda law. Otherwise, why introduce the bill at all? However, when I looked up United States Code Title 38, which gives the full authorization for the Veterans Administration, there is a specific section fully authorizing the Secretary of the Veterans Administration to purchase national media time and space for the explicit purpose of spreading accurate, reliable information. The reason the bill did not pass is because they simply amended the code to begin with. That amendment came the same year that the bill stalled in the Senate. So we now have had 8 years where it's been legal for the VHA to buy national media time and space to spread information about veterans' benefits. And yet, I can think of no effort that I have seen in a newspaper, a magazine, a TV commercial, or a radio buy. And I used to work in the radio business, so I've heard a lot of commercials. We need to address the restrictions on who can use VHA benefits. Because all veterans are included eligible for enrollment in the program under this proposal, excluding again those given dishonorable discharges, I think for obvious reasons, there will be virtually no restrictions on who can use these new benefits. This will also speed up the application process, as determination of eligibility will now only require verification of an other than honorable discharge, disregarding the veteran's economic capabilities or the severity of their disability. We can address the other barriers to VHA healthcare access as well. Allowing veterans to remove themselves from the hyper-centralized VA healthcare system increases access for geographically isolated, rurally living veterans. The hope is that the simplicity of new eligibility requirements will also speed up processing of applications at the Health Eligibility Center, eliminating the barrier created by the slow-moving mechanisms endemic within the VA. Eligibility criteria will also become remarkably easier to understand for veterans wondering if they are qualified to receive benefits, tearing down the barrier of complex eligibility requirements that often feel like a moving target to today's veterans. And of course, it'll help fix the public perception of the VHA. This proposal is such a radical shift from the way the VA works now that the public can't help but take notice. It would be such a foundationally different product from what the VA puts out currently that, if executed properly, it would likely make an everlasting difference in the general public opinion of the VHA. Much of the American public appears ready for a discussion regarding universal health care, and while this proposal applies only to veterans, there's a good possibility that it will at least be well received by the general voting public. The American people are generally supportive of the government's efforts to increase benefits for our nation's veterans. But all of this will simply fall by the wayside if we don't come up with some kind of new education initiative for our nation's veterans and veteran service organizations. Even if the VA adopts no changes to the way it delivers health care, there must at least be a change in the way it promotes eligibility for coverage. The VA should be empowered to reach its customers through whatever means necessary to let them know how to take advantage of the benefits they've earned through their military service. Any proposal considered must include an offer of free, at-their-convenience training for leaders of all local VSOs in the United States. Studies have shown again that VSOs are one of the country's leading sources of misinformation for veterans not enrolled in VA services, a very unfortunate and frankly unacceptable reality. The VA should take sincere steps to boost the visibility and publicity of accurate information and take the time and effort to train those with the greatest ability to reach veterans. So I know that was a lot of information to take in all at once, and if I could summarize this proposal in any way, it would be again to repeat the remarks that Governor Chris Christie had, that veterans should be able to show up at any hospital in America and receive the care that they need. By authorizing subsidization of private PPO plans, veterans